COVID-19 is what you might call an equal opportunity infectious disease. If you get exposed, you will probably get infected. But it's become clear that just as not all patients with the disease are affected equally, some communities are also being hit harder than others.
There's a number of things that have been recommended, such as physical distancing, sheltering in place, and all of those sorts of things. But for marginalized populations, it's much harder to do that. You might have to take public transportation to get groceries and then to bring that food back home. And at each step along the way, there's an elevated risk of coming into contact with other individuals.
The mission is to reach out to those who are underserved, uninsured, that feel more connected if we go out to them in the community and can deal with their care on an individual basis.
We're out here just trying to get closer to their homes, just to make it easier for them to come to their daily appointments.
And if you can bring the services to where people are and to do the work out in the community, it will actually reduce the transmission broadly.
The Community Healthcare Van started in 1993 to combat infectious diseases like HIV and hepatitis and provides a variety of services from needle exchange to mental health counseling.
One of the things about such mobile medical clinics is they can rapidly respond as the community needs respond. One of the things that emerged was that there was a great need within the community to really deal with the unmet needs of newborn mothers and their children. And unfortunately, you can't weigh a baby through virtual, telehealth. And so you also can't measure their bilirubin and all the other postpartum complications.
I got involved with the community healthcare van early in the pandemic. I was looking for a way to see babies in the community.
Mothers didn't want to bring a new baby into a crowded office or into a crowded clinic. So the Department of Pediatrics reached out for us to ask if we could remission the van for a little new purpose. So we see only an individual mother and baby on the van and check out the mother and the baby.
So our goal is to, drive the van to these high-risk areas, and, we're dispensing masks, not only for the mothers, but for their families, their friends.
What this model does is allow a more low contact exposure way for families to access this care.
Due to the COVID-19 pandemic, the Community Health Van can't see the normal number of patients in person, but community outreach continues to help people get the supplies they need.
We're out here our main goal is to distribute as many masks as we can and educate people.
We do outreach, we all give it masks, we bring needle supplies, syringe, Narcans, and we go to every part in Connecticut. But the overall issue about everything that we do is to keep people safe.
We do telephone visits. We also provide mental health counseling with our psychiatric nurse practitioner and our social worker and substance abuse counselors.
I came to New Haven in 1973. This is my people. This is the people that I grew up with. This is friends, people that I know. So, I want to help everybody, but, I want to help my community.
This is not only about providing care to people who need care and might avoid seeking that care, but this is about doing our part in a small way, one piece of the puzzle, to decrease community spread of coronavirus.